Do you have difficulty coding PDX in OB records? Are you planning to attend for any type of medical coding interviews? Are you planning to write CPC certification exam? If your answer is yes for all these questions, so this session is very useful for you. In this session, we are going to learn how to code or how to select PDX on OB records. As a medical coder, most of the medical coders, so selecting PDX on OB records is very complicated and little bit confusing. So but in this session, I am going to make you clear, so you don't need to worry from future, so you can code very comfortably. So my name is Harish Gupta, medical coder, process trainer, content creator for FastCoder 21 free medical coding YouTube channel. So in my channel, I will provide latest updates about ICD-10 CPT, ECPICS, and also I will provide latest updates about inpatient coding, outpatient coding, and anesthesia, SCC, so on. If you are visiting for the first time, please click on subscribe button to receive future updates and also to provide motivation to me. So today our session is, do you know how to select PDX and OB records? So if you want to clear your total confusion, please watch this video until the end. First here we need to learn what is PDX. So based on UHDDS definition, so UHDDS means Uniform Hospital Discharge Dataset. As a medical coder, everyone needs to know about this one, and most of the time we will use UHDDS in inpatient coding. So UHDDS defines the PDX as the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. In other words, the PDX is the condition primarily responsible for the patient's admission. So basically, whenever patient is admitted to the hospital, so we can't code each and every code as a PDX. We need to follow the UHDDS definition of principal diagnosis. So based on that only, we can choose our PDX for current visit or current encounter. Here we need to check the condition which necessitated the patient's admission into the hospital. For that, we need to take it as a PDX. Anyway, no need to worry. We are going to see few example scenarios after this. Next one is, as our topic is selecting PDX in OB records. So now we need to know when do we code complication as the PDX in OB record. So we can code complication as the PDX if the patient were admitted for routine pregnancy and developed a complication after admission or during delivery. So basically patient is admitted for routine pregnancy. So afterwards, if the patient develops any complication after admission or during delivery, we need to consider complication as the PDX. Next, we will check few example scenarios here. So Julia presents for delivery at 41 weeks in labor without any pregnancy complications noted. So Julia delivers presbyterially. So here we need to check which is the PDX. Here I will explain you how to select the PDX in this scenario. In this scenario, we need to code two codes. In this scenario, the PDX will be post-term pregnancy. As per ICD-10 guidelines, after 40 weeks of pregnancy, we need to code it as post-term pregnancy. And also, patient has precipitous delivery. So we have one code for precipitous delivery also. So precipitous delivery means basically rapid delivery. So for that also we are having one ICD-10 code. So that will be our secondary code. So here our primary code is post term pregnancy and our secondary code will be precipitous delivery. Here the PDX will be post term pregnancy. Just you need to think why. So basically based on our definition of principal diagnosis or PDX, the condition then prompted the admission here. So here the condition is post-term pregnancy. So because of post-term pregnancy only, physician has admitted into the hospital. So here we need to code it as post-term pregnancy as PDX followed by precipitous delivery ICD-10 code. Next, we will learn second scenario. So, Stacy presents for delivery at 39 weeks in active labor. Good. Stacy suffers a third degree perineal laceration which is repaired. Okay. So, she developed preeclampsia early in the pregnancy and was monitored closely throughout. So, among this scenario, we need to find which is the PDX. So, we will discuss that one now. Here, our PDX will be delivery complicated by preeclampsia, followed by a code for the perineal laceration. Why preeclampsia at the PDX? So basically here Stacy presents for delivery. So after the delivery, patient has developed preeclampsia. So PDX will be preeclampsia and Stacy has perineal laceration during the delivery. So here our first condition is preeclampsia. So here we need to code as preeclampsia as the PDX. As we have learned initially, we can code complication as the PDX if the patient were admitted for routine pregnancy and developed a complication after admission or during delivery. So basically here, after admission of Stacy into the hospital, she has developed initially preeclampsia and during delivery she has developed perineal laceration. So we need to code preeclampsia as well as the perineal laceration, and preeclampsia is the PDX as which is the initial condition for that patient was treated. Now we will check third scenario. So Jennifer present in active labor. There are no complications noted during this pregnancy. During delivery, the Jennifer suffers periurethral tear. So now we will discuss rationale for this PDX. In this scenario, we need to code periurethral tear as the PDX as it is a complication and there are no pregnancy complication to the Jennifer. Next, fourth scenario, Christine admitted for delivery from the ED. So Christine has a history of hypothyroidism and this is well controlled on synthroid. So before delivery, the Christine developed a sudden decrease in blood pressure. This was monitored and treated with additional IVF. The baby was delivered without any other complication. So in this scenario, now we will learn how to select the PDX. Here the PDX will be hypothyroidism, pregnancy complicated by hypothyroidism. Because of the hypothyroidism, patient has admitted into the hospital for delivery. So we need to code hypothyroidism as the PDX as it is well controlled on synthroid. So here we need to code hypothyroidism as the PDX. So in order to stop selecting hypothyroidism at PDX, physician needs to mention that hypothyroidism is not responsible for patient's pregnancy complication. So in that situation, we can code other condition as the PDX. But in this like scenario, physician did not mention any documentation stating that hypothyroidism is not responsible for patient's complication. So here we need to choose hypothyroidism as PDX as which is affecting the pregnancy. Thanks for visiting Fastcoder 21. Please like, share, comment and subscribe so that I will get motivation and I will provide more valuable videos for all medical coded and all medical coding specialties.